Okay.
Hi,
Hi.
welcome to Transformation World. First of all, I would like you to acknowledge you all to making this first step towards self-healing, transformation, self-growth. Takes a lot of balls to do that. So thank you for this. And I'm sure you had a great morning today. You had a workout. Everybody's well fed. You're all comfortable now. So now I can give you a little bit of insight how this whole mechanism works. And we've been talking about the cell and this and that, but we're going to have to dive deeper now. And I'm going to give you overview, and then you will be living that for the next couple of days during your retreat, and then take that knowledge and take those tips that we're giving you and make sure that you are doing it. Okay, not just done that, check box, and that's it. Because at the end of the day, you're the one who is doing the work. We're here only to guide you. Okay? So we're gonna start with the smallest unit in our body, which is the cell. Why cell? Just think about life in general. Life on the planet started from one cell amoeba. And slowly, with time, we're talking billion years, this one cell amoeba turned into trillion cell of amoeba that today we call human body. But again, going back to that one cell amoeba, that one unit was sufficient enough to support life, was sufficient enough to do all the metabolic reactions, to live, to breathe, to eat, to reproduce, multiply, and evolve. That's how one cell is important. Also, we all are a sitting, living example of how cells work. Once upon a time, you were one cell in the ovary of your mother. That cell met the sperm, turned into 2 cells, 8 cells, 16 cells, 25. Next thing you know, trillion cells. Okay? And this is how we develop as well, from one cell. You have to make sure from now on for the rest of your life to remember that the secret is in the cell. The secret to your disease, the path to your disease, the path to your well-being, the path of your longevity, everything lies in one cell. Now I'm going to take you into your cell. I'm going to give you overview and anatomy. I'm not going to give you much details because it's too much, because this complex organism that was created by God is so complex and yet kind of simple, because everything, and again, we're going back to the cell. So the cell is like a room. Imagine the structure, the house. And within that house, you have a lot of machinery, workers, that are doing the work. There are workers who create and build protein. There are workers who create and build fat. There are workers who create and utilize the oxygen. There are workers that create the waste. It's a waste department, I call them. They remove the waste. There are workers that are dealing with sugar going back and forth. Okay, so each of those structures within the cell, we call them organelles. Not organs, but organelles. The tiniest part, tiniest organs of the cell itself. And in each organelle, we have chemical reactions are happening. So in the cell, you have chemistry, biochemistry. Obviously, chemicals meet each other and create something or destroy something. And at the same time, you also have physics. Positive ion, negative ion meet together and create something else. So there's a physics and there's chemistry in our body. Why it's important to remember physics? Because you are not only going to learn how to feed your body with the physical, your body is not just physical. Your cell is not just physical. Your cell is also non-physical, which is energy. Okay. And your body with chemistry produces energy, the energy enough for you to breathe, to think, to move around, to sleep. This is all energy. So chemistry turns into physics. And then if you want to take even deeper into metaphysics, so we're talking God, we're talking mindset, we're talking your thoughts having electric charge. We're talking about your feelings having electric charge that also affect your physical, your hormones, the function of the cell. Please understand also the cell itself. Imagine the walls of the cells, and then within that house, within that wall, there is a fluid. Okay, it's not really thin fluid, it's like a colloidal fluid. It's a very thick fluid that holds the internal space. And within this fluid, there are floating organelles that creating different reactions in the body. So this is rough overview of the cell. Now, imagine if everything is going well and every worker doing their job and the waste is being removed and not that much waste is coming, this cell working perfectly. And this cell can last longer than 120 years. But imagine if you have too much of the waste coming in, the waste is not being removed. So that's all starts with the waste workers. The workers are responsible for waste management. And imagine the people, the bakery still has to bake, the medicine still has to work. This is basically, you are a walking factory. Your cell is the walking factory. So then you keep producing that waste and it's accumulating and accumulating and accumulating. And as a result, these organelles start to suffer. And the first organelle that starts to suffer is organelle called mitochondria. You all heard about mitochondria. It's a powerhouse, it's this house, it's that house. So imagine if within the cell, all the workers are producing something and it all turns into energy. Remember, chemistry turns into energy. That energy has to be stored. So each worker that created energy brings it to that bank called mitochondria and stores it there. So why it's important? Because when the whole entire community needs help and energy, mitochondria starts to release that cash, so to speak. Okay, these are the transactions between organelles. Are you with me so far?
Yes. Sorry.
So, why am I taking you that deep? Because imagine if you know how every bolt works in your cell, you will be in charge of what you're eating, what you're not eating, what you're supposed to do. You will be the one who will be pushing the button. You will no longer will be dependent on other people's opinions. You will be able to analyze, like, for example, if we're giving you information and we're telling you how this mechanism, this particular drug or this particular supplement, the mechanism of action, you will be able to interpret how it works on the cellular level. And guess what happens? As soon as you interpret that, something happens in the subconscious mind that it just evokes that healing process. Remember, we have a physical level, physical layer of your healing, and we have non-physical layer of the healing. And there is a constant interaction. Okay? So it's important to remember that. Now, toxins, waste. When we produce waste, let's say we're not bringing that much waste, but we produce waste, it needs to be removed. It needs to be removed from the cell, and your body needs a certain vehicle system that comes in, the truck pulls up, and then that truck, which is specific vitamins, we call them binders, and you're going to be hearing this over and over again. You have to be on the binders, you have to take binders, you have to prepare your body. This is what you're doing. You're bringing the army of trucks, pulling and getting ready. I don't know if you guys from the snowy states, but when in New York, they say, oh, it's going to be a snowstorm, you have hundreds of trucks ready with the salt on the side of the highways, ready to work. Basically, that's what happens when you start preparing your body for your detox. These are binders, okay? So they come in and they pull out and they wait. The workers bring the waste, put it on the truck, and the truck has its own trajectory, knows exactly where to dump it. Instead, compared to other detoxes, your workers bring it outside of the cell, dump it, and leave it there. You see the difference between the regular detox and the cellular detox? The cellular detox, you're dumping it into actual truck that it's removing it, and a regular detox, you're just dumping it outside of the window of your house. And then guess what happens? It sips through and comes back into your house again. Okay? That's why it's important when you're going to go through cellular detox process, not to skip anything, not to cut corners. It's very, very important. Now, this is the cellular transportation we're talking. Now, one of the main, let's talk about toxins. And you guys did some toxicity tests. Who had a clear urine? Raise your hand. No one. You know why? Because you're a live person. You will clean yourself, but then you intoxicate yourself. It's just the way it is. You see? The question is not to be squeaky clean and have clear. The idea is to make sure that you are aware of the degree of your toxicity. And if you look at the card, in the card, you have clear, which is perfect, which usually happens after a very, very good cleanse, cellular cleanse, and staying very, very good on your diet without any cheating for good 3 to 4 months. This is when you're going to get clear one. Okay. And then after that, you have slight pinkish, which is mild, which is also acceptable, by the way, because you're human, you're alive. Then after that goes more pinkish, which is, we call it moderate. And then you have this almost burgundy fuchsia color that is very bright. That is severe. So the darker it is, the more oxidative stress you have in the body. What is oxidative stress? It's that exactly that the waste material that is sitting in your house, in the garbage bag, and not being removed. And you have 1 bag, 3 bags, 23 bags, 30 bags. So this test is showing you, girl, you have 35 bags in your kitchen and your kitchen stinks. What are you going to do about that? That's what it's showing. Okay? Do you have any questions so far?
Question.
Yes?
When you do the nutrient binders, that's taking the waste. It's carrying the waste away from the extracellular outside your body versus the waste is going extracellular and it's creating this osmotically toxic environment, and that's oxidative stress, correct?
It's basically, we call it reuptake of toxins. The
Okay.
toxins are floating around, and the body is very, very intelligent. It's all about cleansing itself, so it reuptakes this and it grabs that toxin. And now it doesn't bring into your muscle,
Mm.
but what it does, it brings it into your belly, into that metabolic fat, into your omentum.
Oh, is it storing it into the adipose fat then?
Yep.
Oh, that makes sense. Okay, okay.
So we have this omentum, and it's the visceral fat.
Yeah, thank you for saying that. That was exactly, I just wanted to point it out to everyone, because everyone understand the visceral fat, right? Visceral fat around your organs.
Yep.
This is why we have, this big belly, right? Fat. Yeah, thank you.
Yeah. So when it's actually now we try, doctors who are aware of this, we're trying to put the waist measurements and the vital signs. So when you go to see your primary care doctor, besides checking your blood pressure, besides checking your weight, besides checking your height and all that, to measure your waist. And if your waist is more than 35 inches for women, that is by definition you in metabolic disorder, any kind, any sort. Okay. So if if you notice yourself, like when you even look at the old dogs, like if someone is walking a dog and you look at the dog, even if it doesn't have like a changed color or hair, you could tell that this is an old dog, because older dogs, they have what? They have belly. Because with age, with time, this visceral fat collects the toxins. So the idea is to break that pathway and remove it from the cell directly, and not to let that toxin to go in there. You see?
Yeah. that makes sense.
Yeah. And another very important component to all of that is lymphatic system, because lymphatic system is a sewage system. Okay. Everything is just being drained into lymphatic, and lymphatic system doesn't have any valves. It doesn't have any muscles. If your arteries have muscle and they pump the pressure. If your veins have valves, they move blood through the valves. Lymphatic system doesn't have any of that. And the only way to shake your lymphatic system is the impact. Jumping on a trampoline, doing some kind of running, jogging. That is lymphatic system, or using certain machinery. People use, like we use acoustic wave therapy for that. When you hear lymphatic drainage, lymphatic massage, this is what it is. You see, guys, now you're trying to understand. If someone is trying to sell you packages of this and that, you will be in charge and in control and say, okay, I'm doing my cellular detox. I have to do some lymphatic drainage. That's why we recommend during lymphatic drainage, not only jumping, but imagine this thick material becomes very, very thick, almost like a sludge. So first you need to thin it out. That's why we drink hot water, or hot water with lemon, to thin it out. And apple cider vinegar, that also makes it thinner. That's why we drink it daily, to do that. Okay, so you're thinning it out, and then every dumpage, all the trucks are dumping into that sewage system. Then it flows and it dumps into your colon. And colon has to work. That's why we're all about bowel movement, bowel movement, bowel movement. You have to have at least one bowel movement, if not 2 bowel movements a day, because it's all draining. Because you're not getting bowel movement. You can take all these vitamins, but you're not getting good bowel movements. Then lymphatic goes there, and it's like clogged pipes. It can penetrate into the bowel. And what happens to your toilet? It gets stuck, and then everything starts to go up, right? And your body goes, oh, where you going? Where you going? No, 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 no. We can't do that. And this is where your visceral fat goes, okay, I'm going to store it. Give it to me. In order for you not to die from this intoxication, your visceral fat is actually a defense mechanism to store this. Do you understand now? And that's why, guys, in the GYN surgeries, when someone has cancer, we always do procedure called, besides removing the cancer, removing ovaries and uterus, we do omentectomy. Because all the cancer material, all the toxins are sitting there for the same reason. Okay? So that is the transporting system of cellular detox. Cellular detox, I can talk about this till tomorrow. Each detail, like every vitamin you will be taking is responsible for specific things. I'm just giving you overall story how your cell works. Now, another thing also, besides cleansing, you want to make sure that you're not bringing the waste into the cell. The most common waste that comes into our body is sugar, the most toxic one. Okay, yes, microplastics, yes, certain medications, environmental things, yes, 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 yes. But sugar is number one. So when the sugar goes in, it goes into the cell. The sugar is that raw material that the whole cell goes, yeah, we got raw material, now we can build energy. And they take it and they build energy and they send it to mitochondria. Then more raw material comes, they build more energy and mitochondria stores it. At some point, mitochondria goes, okay, we're done. We don't need that much. We're done. And she shuts up, but completely shuts down. Doesn't let sugar go in. Now, the whole cell goes, okay, we don't need it anymore. But the sugar keep coming. We don't need it anymore. And it keep coming. And there's an avalanche now. And instead of just nice and having a snowy day, now we're having avalanche. Now it's not fun anymore for the cell. Now it's work. And now it's a disaster. So then we have this component called insulin that is responsible to take sugar inside of the cell. So then your body starts producing more insulin, more insulin, more insulin. And the body goes, your cell goes, no, 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 we're not taking it. We're not taking it. And insulin starts to go up, 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 up. And we have it, what? Insulin insensitivity. You have high levels of insulin, but the cell goes, no, we're not taking it. Get it? Okay, this is beginning of prediabetes. And at some point, your pancreas cannot produce insulin anymore. And then the insulin goes down, sugar goes up, and we call it diabetes. Now, when the whole thing happens, when you have so much sugar in your body, and you would be surprised when we say so much sugar, you go, a lot of my patients go, I eat healthy. And I go, well, let's see how healthy you eat. Let's put that thing on. And it's going to tell you how healthy you eat. And you'll be surprised. Things that you think healthy, not healthy for your body. Every time when you have spike, it's not healthy. And Angelina will be guiding you through this and explaining how it works. All right? Now, when the sugar is high, your blood typically has to be nice and flowy and thin and flowing, and highways are working, which is your vessels, and everything is great. But then when you have this sugar that it's not getting into cell, but sitting in your vessel, little by little, your blood becomes thicker and thicker and thicker and thicker, and it becomes sticky. And when it gets sticky, it sticks on the wall of the vessels. And then guess what happens? When you have caramelization, when you do the caramel, when you heat it up, we call it glycation. Okay? So that's what happens with the vessels of your body. Not only veins, we're talking vessels of your kidney, vessels of your heart, vessels of your brain, vessels, and I can go over and over, like for all the organs. Every organ suffers because it turns into this caramel, toxic caramel. You see? And this is when, next step after that, dysfunction of the organ. Some people have symptoms of thyroid, some people develop symptoms of something else. This is how autoimmune disease starts. This is how diabetes starts. Everything comes from this process. And whatever I just described, it's inflammation. It's the collection of oxidative stress. This is what I just broke it down for you. That's what your body goes through during high toxicity. And the most common toxin, of course, is sugar. There are so many other toxins, but first we do sugar. We start with sugar first. We teach you how to work with that, and then you can work with other toxins on your own. We're showing you the principles here. Now, I just described you disaster, what happens in the cell, and then what happens in the whole body. Hormones are signaling systems. We have a lot of signaling system in between. These are the regulators, okay? These are your security workers, your policemen, your military. This is what hormones do, okay? This is your internal intelligence, I would say, mostly, because military is your immune system, but intelligence is your hormones. So that signaling system gets disrupted. Imagine if you have disaster after disaster after disaster after disaster, the signaling system gets tired and then finally exhausted. That's one of the things. The second thing is, I would say number one, actually, nutritional deficiency. So the hormonal problem starts from nutritional deficiency and lifestyle deficiency. When I say lifestyle, not necessarily not to drink, not to smoke, not to exercise, but it is actually your reactions to external worlds, how much sleep you get, how deep you sleep, all these, how many emotions you discharge during negative emotions during the day or positive emotions during the day. So that is all affects the work of your hormones. Okay. So now, if you don't have enough building material, which is not only food that you take, but vitamins. And the most important vitamin is vitamin D. That's why everywhere we go, we start with vitamin D. It's a building material for entire, not only human body, anything in the world, nothing that not uses vitamin D, except maybe plankton, which is down on the ocean. The reason why there's life on the planet is because the sunlight was shining on the planet and making organisms produce vitamin D. And that vitamin D was used as a building material to build your hormones, to build your immune system, to build your structure, your skeleton, your muscle, your brain, your nervous system, you name it. Okay, so nutritional deficiency. And the second one, like I said, stress, physical stress, and oxidative stress, which is we just discussed. This whole thing put lots of pressure on hormonal system, and then disease happened. For example, again, vitamin D and thyroid. You just asked about thyroid. Thyroid is the conductor of all endocrine organs. If conductor is not doing the right thing, the whole orchestra is out of whack. But conductor or director or manager uses vitamin D as an assistant. Just picture that. But what if your assistant is not showing up and you are that thyroid, that conductor? Your assistant is not showing up on time, calling sick, always lazy, smoking weed, always high, not functional at all. And you have to do everything by yourself. You do it once, twice, 3 times. You're going to work 1 year, 2 years, 3 years. Everybody comes to your office, says, oh my God, what a beautiful thing you created. And you smiling. But in reality, you're exhausted. And then at some point, and this is how thyroid looks. Like you could go to doctor's office. They check your thyroid. You give them, I'm tired. I'm fatigued. I can't go to the bathroom. I'm losing my hair. Giving all the symptoms of hypothyroidism, but your thyroid is normal. Your doctor says your thyroid is normal. Nothing is wrong with you. But the process is happening. Your body's compensating. Your body's holding. This is when you're smiling, but you're not telling everyone that you're doing it on your own. And then one day, you say, fuck this, excuse my language, and you just quit. Or you say something. And this is when we get a diagnosis, when it starts showing up on the blood test. Okay? So this is one of the examples. Another example also, imagine the whole system is under stress, including your immune system. And now you have so much toxicity sitting in your thyroid cells because they're not being removed. The trucks are not coming. The building material is not showing up in your factory. Everything is stressed. There's a shortage of supplies. You're tired. Everything is tired. And you're building and building and building. As a thyroid, you're building this toxic material in your cell. And then you have a police, which is your immune system, circulating through the body and looking around. And they start smelling something. And it doesn't smell good, they say. And they look at the thyroid, and it's a thyroid that is smelling. They recognize the thyroid as a foreign body, and they start sending raids and attacking it, sending the troops on it, and attacking thyroid. This is the process what we call autoimmune disease. I'm showing you autoimmunity on the example, with the example of thyroid, but you can put psoriasis, your skin, you could put your IBS or your ulcerative colitis with your bowel, any organ works the same way. The autoimmunity works the same way. That when your immune system start recognizing your organ as a foreign body because you have such a high level of toxicity of oxidative stress that it's not being able to recognize its own brother or sister. It thinks that it's foreign because it's all covered in shit, and it starts attacking it. Okay? That's how hormones go out of order. And then when the thyroid is out of order, even if you're not developing thyroid disease because your body is so strong, holding it, your body's all about compensation. Then comes your reproductive organs, reproductive hormones, your testosterone, your estrogen. And this is when you start with the same principles. If you don't have enough building material, your bodies try to compensate and produce more estrogen. And then if you're producing more estrogen, if you have storage of fat, guess what? It's the best place to put estrogen there and store it just in case. It's a very, very complex, but the principle is the same. It all starts with the cell. It all starts with oxidative stress, waste material in the cell that creates havoc in your body.
So no, it's a quick question because you just touched on that, but we have some women in the room that are want to get pregnant, and I just want you to talk about the infertility and how, again, the cellular inflammation, it also impacts infertility. So can you draw for us this connection and what could be done to address that?
Yeah. Well, fertility is a very interesting subject. Yes, all the cellular detox affects fertility, but also remember, we do have a certain amount of eggs that we came to this world. Okay, that's how Mother Nature made us. We came with a basket of eggs. We don't make eggs. We bring it and then we ovulate one after the other, one after the other. Men make their sperm every 72 hours. We don't. We have what we have. Now, as you start ovulating, you decrease the number of eggs. So if you have a big basket, it may last you until you're 50. And that's why you hear certain stories. Oh, my grandma had a bit, my mom, when she was 49. That's because she had good genetics. You see? So that's very, very important factor. You need to know what is your maternal lineage, your feminine lineage in terms of reproduction was like, when the menopause started and so forth. It's very important. The next factor is, of course, the same thing, toxicity, cellular oxidative stress that impacts every cell, including your ovaries. You see? But another very important factor in this, cortisol. Cortisol is the hormone of stress, we call it, right? But it's just a fancy word, stress, but it's your reaction to external world. Every time, like, I'm going to take you back when we were in caves. You and I, back in the days, in past lives, we were in caves. And we had two problems: find something to eat and not to get eaten. So let's say you're a woman in cave and it's the middle of winter. And at that moment, you won't reproduce, you won't ovulate. It's a defense mechanism. Why? Because if you reproduce and ovulate, you'll be pregnant. Your body, it's winter time, so your body doesn't have nutrients. Then you will be eaten by a lion. So we develop this circadian and seasonal changes, adaptation in our body, that we typically don't do that. Now, when today we don't have lions, but we have scary things in our life. They're not really scary, but it's our reaction. So every time when you watch a scary movie, listen to the news, or listen to someone else's story, you produce same toxin, same cortisol. It's not toxin, it's a necessary hormone, right? And the body reads that you're in danger. And if on top of that you have nutritional deficiency, like let's say vitamin D deficiency, so the body thinks we're not only in caves surrounded by lions, we're actually in the middle of the winter. And it shuts down your reproductive system and doesn't let you ovulate. So that is a very important factor. We have diagnosis called unexplained infertility, when your ovarian reserve is normal, the sperm is normal, the tubes are open, you're showing some hormones that is actually fluctuating and possibly ovulating, but you're not getting pregnant. And we call it unexplained infertility. I think it's explained. This is my explanation. It's the cortisol that's causing it. So now we're talking oxidative stress that causes premature ovarian aging. The quality of the eggs change. And then the quantity changes too as we age. And on top of that, we put cortisol and telling the body that we're in the caves. And the body's like, are you out of your mind? We're not getting pregnant. We're going to die. You see how it works?
Guys, are you clear on the story? This is like, it could give you a lot of answers, answers, right? And when we, yesterday we talked about how some of us like wake up in the middle of the night and then maybe we work or we go to bed late, right? Or we, wake up at 2 and then we work for, a couple of hours at night. That's spiking your cortisol, guys. That's spiking your cortisol. That's exactly what she is explaining right now.
Yeah.
Ow, stop.
What?
Let's do some, no, she says like, stop, they're already frightened by the story, yeah. Let's do
Well,
some.
this is how we build, girls. This is how we create. This is the machine. We're taking you under the hood of the machine and explaining how each bolt works. So
Yeah.
then you can reverse that and change it.
Yeah.
Love it.
Let's do some takeaways. So while doctor is still here, so we just make sure that, we understand what we're talking about. Any takeaways? Who wants to share?
I have a question. So when the waste goes into the visceral fat, obviously those cells get larger.
Expand.
So how does your body differentiate peripheral fat from like the adipose or the peripheral from the visceral?
If it's toxic, there's two types of fats: brown fat and visceral fat. The brown fat you develop during workouts when you eat healthy. Your body's intelligent. So it says that it's utility. You need that fat. Okay, so it's sent into your muscle, between your muscles.
Yeah.
But when it's toxic, they have a place. All the toxic material has to be stored over there. Each of us have a place in the house, girls, no matter how clean you are, we all have a place in the house. We have either or a drawer or the room or the corner. It's called everything corner. You do the cleaning and then you put it there and say, I'm gonna throw it away later.
Yeah,
This is what's visceral.
yeah. So the visceral fat's around our organs, but then the fat that like collects on our arms and our legs, we
In the
don't.
back, yes.
So correct? We call that a
Yes.
different fat. So how, what's
Yes.
the differentiate between those two fats?
The way the metabolism in the fat is.
Okay, so the
So when
energy,
you have more brown fat, your metabolism is faster.
brown fat's healthy fat though.
It is healthy. You need that.
Yeah, but the visceral fat, so the fat that's like sitting on our arms, that is more extra energy being stored.
If
versus-
you're referring to cellulitis, it's different though.
well, cellulite-
Cellulitis is also fat. We do have some fat here. It's a yellow fat that also plays some role in developing like a collecting toxicity. Not as visceral fat, but still.
Right.
And if when you have cellulite, it's a sign of also toxicity.
Cellulite.
Mhm.
Yes,
Extra energy
That
being
is-
yes,
stored
that's what we brush. That's what we
Yeah.
brush.
Yeah.
for lymph.
So remember, she talked about the lymphatic drainage, right? So I mean, like you go to the cosmetologist and they will do all this, like procedures that actually do not work. This is toxicity. When you start taking care of your cellular inflammation, this fat will go off, especially if you guys gonna do, and I'll show you, I have it in my home. I'll show you how to remove cellulite during the cellular detox. It's very easy to do. You don't need to pay $3,000 to go to the clinic and do that, okay? While you're detoxing, okay? Now, so another thing we talked about, lymphatic drainage, jumping on a mini trampoline while you do cellular detox. It's an amazing modality because, you're basically, removing the toxicity, right? So along with all those binders, sweating in a sauna, right? So that all helps with this fat. And by the way, talking about the fat, Shahnoz, I know that you can detect the visceral fat on MRI, but does ultrasound can also detect that or just MRI?
No, not that much. Not that
Yeah,
much.
just
But
MRI.
don't forget, the idea not to get rid of visceral fat at all, because you
Yeah,
need
yeah.
that fat.
Yeah,
It's
yeah.
your defense mechanism.
Yeah.
And another thing you'll have to remember, if you take a skinny person and you put a fat person in front of, like next to them, people tend to think that amount of cells, fat cells, in the person who is obese is more than the person who's skinny. It's actually not true. Each of us have the same amount of cells, fat cells, that we were born with. Okay? You have these cells. The reason why we gain weight is because the fat cell expands and then goes down because it collects the tissue, right? The toxin expands and goes down. Thus, you have to remember, when you have when you gain weight, you're not increasing fat cells. You're increasing the volume of the fat cells. Okay? So then when you lose weight, it just goes like this. And that's why when people do liposuction, they say, oh, and then fat starts to grow somewhere else. Yes, because if you removed, or here, you've removed fat from the body, but you still have toxicity going on, it has to store somewhere. So then it goes in different places. It all comes back to the same thing. Natural way is the best way. Cellular way is the way.
Yeah.
I think we have,
What you just mentioned, like in my 30s, right, before all my, those practices and getting into the health journey, I actually did the liposuction. I was 35. I removed it from here. And guys, because I got through the cellular toxicity, that it was here on my butt, like in 5 months. So it got from here. Yes. Now, I mean, I had like a flat stomach and then my butt started to grow because of all those things that she talked about. right?
Well, lucky you, it all went to the back on me.
Exactly,
Super flat stomach and
yeah,
the
so,
back.
the same thing, right, Shahnoz, when we, like, like, when, and now we're getting a little bit into the DNA. So, like, when we remove something in a body, then it grows when you have cellular toxicity. Like, for instance, some people remove their breast because they have, what is the gene that they have?
BRCA gene,
yeah,
yeah, it's a
BRCA gene,
BRCA1,
right.
BRCA2. Mhm.
But then cancer shows up in their ovaries,
Yep.
right?
Right.
Because of what,
Not
Shahnoz?
only, even if you remove ovaries and even if you remove breast, cancer shows up on the peritoneum. We call it peritoneal cancer. It still shows up, not because the person is carrying that gene, but because the toxicity that happens.
Mhm. So we don't care really about genes because as we talked yesterday about epigenetics, so with all the cellular detox and the lifestyle and everything that you do, we can turn good genes on and bad genes off, right?
Correct.
So if you have that gene that you're gonna have cancer, no, you need to remove your cellular toxicity and then it will not reappear in your body. So that's not a solution, removing your ovaries or, removing your breast and you still have cellular inflammation. So the cancer will show up in another part of the body.
Yeah, well, I would say someone who is carrying that gene, you still have to do that procedure. And then on top of that, that's what I usually recommend, to do the cellular detox and other things. And the reason why, because this is a very pretty nasty disease. So typically when I test every patient for that gene in my practice, at least I offer. And then if it's positive, we get pregnant as soon as possible, And if it's not possible, at least save your eggs and then go through surgery and then go and cellular toxicity. Unfortunately, with this particular one, you have to do it because the chance is 80%. By doing just cellular toxicity, you're probably bringing it to 20%, but 20% is still pretty high. We're not talking about other genes. We're talking about right now at this moment about this particular gene because it's pretty nasty. But there are some genes, for example, I have a gene predisposing me to diabetes. Am I going to have diabetes? No. Did I have diabetes when I was pregnant? Yes. Am I predisposed to have diabetes? Absolutely. So we're talking about more mild genes that we have 25,000 of them to make sure that you are not turning the bad guys and turning off the bad guys and turning on the good guys in your genes.
And this is why we do for you all this comprehensive DNA test, right? So we have a full picture of what's going on. with your-
Comprehensive DNA test is more like to see again what is your DNA map is.
Yeah.
And what to avoid, what to include, that type of thing. So there are different type of genetic testing to see if you have, to check all your genes to see what you carry. And I do not recommend that carry in terms of disease, risk of disease. I do not recommend that because, like Angelina said, there is an epigenetic. So if I would just give you a whole list and it's like 20 pages of that and say, you're predisposed to have this and 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 this, you're gonna go crazy. So that's why that test, some people do, and you probably come across, but I wouldn't recommend. Go practical, don't waste your time, don't waste your money, do what works and keep it simple, stupid, That's my principle. But yeah, you're right. That DNA mapping test is the one that actually will show you what you should be eating, what your tendencies are, and work on them, not only physical, but on mental level as well.
We have 5 minutes left with the doctor. Let's do some takeaways. So, let's go like around the table. Amanda, what is your biggest takeaway from that?
Well, I'm not sure if to say I have insomnia, but I do not sleep well throughout the night.
Yeah.
And this has been happening for about 7 years.
Mm-hmm.
So I guess that has affected me a lot
Yes.
with the high cortisol levels.
Mm-hmm. Mm-hmm.
High cortisol levels, low vitamin B levels, low vitamin D levels, low magnesium levels, So again, we're going nutritional deficiency and high cortisol levels. Yeah. Yeah.
Because my period has stopped coming about 2 years, and well, I guess as you were saying, we're not getting pregnant based on how my body is responding.
Mhm.
So
I will, if Mandy, you finish, or you want to say that? So I want to jump in. I think that I'm the same. But my mother says that ever since I was a baby, from the time I was born, sleep all day, up all night. And I would say I've been that way through my life. I know of vitamin D deficiency, perhaps there's vitamin B as well. And I'd say high cortisol levels because I just have a very going lifestyle. And when we put on this yesterday, and well, they say it doesn't work well, but the alarm went off a few times because of the low blood sugar. I am seeing the relationship between the low levels of vitamin D, definitely affecting the thyroid. I've had to, I've been on Synthroid, what's the other one? Levothyroxine.
Yeah. Oh, yeah.
Yeah, so I know that those factors are weighing again. And I want to have like 5 more kids, okay, Dr. Shahnoz? So,
Okay, so detox,
right, yeah, lots of connections here. Lots of connections here. And I could see how, rather than put a Band-Aid on it with the conventional doctor, that doesn't get me the result I want. It's just Band-Aid this, Band-Aid that. How is it working toward fertility? We need to fix it, reverse it, not just Band-Aid it. And I can see how I can have that here.
Very
So
good.
thank you.
Yeah, it was really nice to meet you. This was great. Thank you so much for going through the anatomy and the physiology of that you just spoke to my heart and explained it in a way that makes so much more sense, that I can help people myself, but that it creates what I call the supercell, but it makes more sense to me. So thank you so much for delving into it like you did. You explained it beautifully, and I truly appreciate that.
Thank you. Thank you.
Any other takeaways, guys? Questions, takeaways, last 5 minutes with the doc?
I had a quick question. When it comes to, but great takeaways. This is so helpful to understand everything on even more level, and I know what I need to do. When we all did this test, this is what do you call it? The
Toxicity, cellular
yeah.
toxicity.
So on the card, it talks about, thoughts of what to do, taking more antioxidants or methylation protocol. I was just wondering if you have any thoughts for us on where we all landed and what we should do, or Angelina, we can talk about
This is
So
exactly.
I'm glad you asked, but this is exactly what the program is about. You
So it
will,
doesn't-
I didn't talk about methylation, but the transporting system, the methylation, it's basically, that's what you're gonna be doing. You will, Angelina will explain to you what methylation is. If you want me, I can explain it to you too.
Yeah.
I call methylation is Uber driver that Uber Eats, brings you food and takes out the trash in the same time. That's methylation.
My
So
Uber driver-
it brings the nutrients into the cell and takes out the waste out of the cell. That is methylation. The binders are the ones that we explained. So that's what you're gonna have to do. And this is our program. You're already in, so it's gonna be unfolding for you, and you're just gonna have to follow.
I just want to reemphasize that, Shahnoz, she talked about that there is no cutting corners. There is no cutting corners, guys. What we talked about, we spent all day yesterday talking about inflammation and nutrition and, glucose regulation and basically how to get rid of inflammation. So like through food, and today we have practicum in my kitchen. So like this bag that she talked about, like 25 bags, right, of waste in your kitchen. So guys, there is no corners. I mean, this is serious.
Okay.
This is very, very serious. Even the small, like you go to eat your junk, fries, we talked about 51 days to get it off the system. So you just spend so much money on, like all that and the program and going through the cellular detox, and then, your brain and, Amber yesterday talked to us why our brain is, behaving this way, that we want to eat this specific food, and you eat this food and you just detoxicate yourself again. So why did you do that, in the first place? So be mindful, no cut corners, like for 3 months, like 90 days, no cutting corners at all.
So we have a couple minutes. Do you guys have takeaways? Otherwise, since we have her for 2 minutes, could she explain methylation to us really quick?
Oh, she just
Okay.
did.
Okay, so let's just explain quickly. So there is a process it's a natural process in our cells, how to remove the oxidative stress, how to remove waste from the cell. And we do have this vehicle, a transporting system called methyl group or methylation. So that, for example, when you, or bring nutrients, when you take, let's say, vitamin B, and it gets into you, first of all, it has to be absorbed through your stomach, or if you're doing it sublingual, it has to be absorbed into your bloodstream. And then from the bloodstream, it needs to be brought to your organs and feed them, right? That's the purpose why you're taking vitamins. So in order for this vitamin to enter to the endpoint destination, which is your cell, there is a vehicle, a transporting system that stands there and just grabs it and brings it inside of the cell. And while inside of the cell, it grabs the waste material and brings it out and puts it on the vehicles and sends it out. This whole process called methylation, and methylation is governed by a gene called MTHFR. It's a part of the genetic mapping that we were just talking about. It's one of those genes. And if the person is carrying all two DNAs, which is homozygous and carrying it, it's usually the person that was sickly from the very beginning. They have poor metabolism. They were born this way. And then when they get pregnant, they have more complications with pregnancy, so forth. Excuse me. So now, but a lot of people have only one mutation of one DNA strand. So in that case, majority of us are. And in that case, you were born with a certain reserve of this methyl groups in your body. But then depends on your lifestyle, depends how much of toxicity it needs to remove. This reserve can go down very quick or stay sufficient longer. So imagine if you have money in the bank, and if you are careful with the money, it can last you 50 years. If you're not careful, it can last you 2 years. Imagine. So it's the same thing with methylation. So if you have too much of oxidative stress, you keep using these methyl groups to remove the waste material from the cells, and you kind of deplete that by a certain age. In some cases, by the age of 20, 30, 40, 50, depends on your lifestyle. So that gene, MTHFR mutation, is important to know for all of us, because now, if I am selling you my B complex vitamin on Instagram and saying, look, and I'm putting it in my mouth and I'm saying, look at me, I'm taking it, I have so much energy, buy it from me, not knowing how this gene works. You would buy it, but that vitamin doesn't have methyl group if you have that mutation. And that vitamin B will be circulating in your blood. Your levels on the vitamin B levels would be absolutely skyrocketing or normal. Your doctor says that you don't need to take vitamin B because it's high, but you say, but I don't have any energy. That's because it's not being drawn into the cell. You see how it works?
Yeah, okay, that makes sense. So the mutation of the MTHFR is the transport, and that's why the
No,
intracellular.
mutation of MTHFR is showing that you don't have enough of that transporting system and you need help. And another thing also, this is my theory, we have the way, again, it's all, I love going back to evolution because this is how we became what we are. Back in the days when we were in caves, we had hunters and we had gatherers. Those tribes that had this mutation and they were gatherers, they perished. Why? Because from gathering, you cannot get that much of a metal group, methylation. But those who are hunters, they would bring the animal and the whole village would eat it from nose to tail, including organ meats and everything else. And they survived. So that tribe is carrying that gene. And it's a lot of us. But there is also another tribe that doesn't have that mutation. And they were gatherers. They also survived. And that's why we have today people who are carrying this gene mutation and they don't carry it. Those who don't carry gene mutation, they could be vegan and they could live long and look good. And they say, look what vegan diet does to me. And we all go, oh, wow. But then if you're carrying this mutation, you go on vegan diet, you may feel a little better for a year or so because you detoxified yourself. But then you start noticing that it's actually reversing now and you're getting older, you age faster, and you're getting sicker. That's because you're not born to be vegan. You were born to be omnivore, carnivore, or whatever. You need to have that methylation group in your body, in your diet. I know it's very complicated, but knowing that, especially when you do DNA mapping, knowing that will again distinguish if someone will be pushing diet on you, understanding and saying, this is not for me. My genes are telling me what to eat. I can't eat this, or I can, but I also have to do this. When someone has this mutation, it's not about excluding. It's about making sure that you're including certain things that have a rich metal group in them, and you are helping your mutation and helping your cells in the methylation process.
Okay, thank you so much. That explains a ton.
This is why in the last year, when I discovered my DNA and I understood why I gained so much weight in the last year when I started to eat everything, because I have this gene mutation that cannot metabolize saturated fat. I cannot eat red meat. I cannot eat butter. I cannot eat, ghee. And I was like piling up on that. So that what happened. So right away, and this is why vegan diet works for me. It's not going to work for you. This is why do not teach any diet, guys. We do not teach that. We teach you how to figure out what works for your body. Like you said, Olga. So you become a friend with your body, right? Yeah. All right. So, any last words, Dr. Rustamova? Because after that, we're gonna connect Amanda with you for 10 minutes for any personal questions. We're gonna do it on Olga's phone, and that's pretty much it.
Sure, sure. So I say again, I commend you. I'm proud of you for doing this because it takes a lot of balls. And thank you for showing up. Just don't give up.
And
Just
guys,
don't give up.
for those who are in our big program, so you already know that you have access to the doc, right? So, and you're like all set up for the 6 months and, like all the good stuff and the personal text messages and everything. And for those who don't, so here is a doctor who is in a big program and who is going to support you if you decide to jump in and do this with us for 6 months. So you have her in your pocket. Shahnoz, sending you much of love. Thank you so
Thank
much
you, guys.
for coming out.
Great.
We love you. All right.
Love you too. Continue good work. Good job,
Yeah.
everybody.
Okay. Bye.
Bye.